Good afternoon, ladies and gentlemen. Thank you, Mr. Chairman, for your kind introduction. I will show you our study, whose title is Semen Parameters in Men with Varicocele, DNA Fragmentation, Chromatin Packaging, Mitochondrial Membrane Potential, and Apoptosis. Firstly, I must mention that our group has a research project started in 2006 and has 15 papers about laboratory procedures that include semen analysis and the cytochemical analysis. Regarding semen analysis, we use World Health Organization parameters, except morphology that we apply in MSOME. Concerning cytochemical analysis, we use DNA fragmentation, chromatin packaging, mitochondrial membrane potential, and apoptosis. Initially, I will talk about a general aspect of varicocele and the literature. Since 1955, we have evidence that varicocele impairs sperm quality, and several studies suggest that varicocele promotes high levels of oxidative stress in semen, which consists of an imbalance between overproduction of ROS and reduced total antioxidant capacity. Thus, men with varicocele may have alterations on semen parameters and sperm DNA integrity. Now, concerning semen analysis or semen parameters, based on the literature, varicocele is associated with higher testicular temperature, testicular hypoxia, and the accumulation of toxic metabolites and oxidants in semen, which reduces sperm progressive motility, sperm concentration, and sperm morphology. About cytochemical analysis or cytochemical parameters, on the topic of DNA fragmentation, men with varicocele present increased levels of DNA fragmentation in semen, and there are three possible reasons for that: abortive apoptosis, abnormal chromatin packaging, and oxidative stress. So patients with varicocele have a high percentage of sperm with fragmented DNA. Generally, majority of the authors agree with these observations. With regard to chromatin packaging, infertile men with varicocele have high levels of abnormal chromatin packaging in semen, and a plausible explanation is the defect in exchange of histone by protamine in the spermatid nucleus, and this abnormality makes the spermatozoa or sperm cells more susceptible to DNA damage. As well, on this topic, most of the research agree with these comments. About mitochondrial activity, we know that sperm motility depends on normal function of the mitochondria located in the mid-piece of the spermatozoa, where the ATP is produced. And it's important to note, considering oxidative stress, that organelle mitochondria is a major source of intracellular ROS. So patients with varicocele have high percentage of sperm with inactive mitochondria or mitochondria with damage. Then, on this topic, most of research agree on this fact. Finally, I will present literature on varicocele and the apoptosis. We observed that germ cells die during normal spermatogenesis, and this process is one of the main physiopathologic mechanisms of testicular dysfunction in patients with varicocele. And this pathology has been related with high levels of apoptosis in semen. There are three plausible pathways for apoptosis occurrence: excessive heat, reduced level of testicular testosterone, and the accumulation of toxic metabolates in semen. But there is one paper by Fujisawa and the collaborators that reported that apoptosis was decreased in patients with varicocele, germ cells like spermatogonia. So, for all that has been stated, The aim of the present study is to evaluate the effects of varicocele on sperm quality and the cytochemical parameters that I have just mentioned. Considering material and methods, this cross-sectional study included semen sample from 2,399 men from couples in infertility investigation, and the incidence of varicocele in this population was 16.3%. Varicocele diagnosis was made by physical examination and or ultrasonographic evaluation, and in our study, the patients were divided in study group, presence of varicocele, control group, absence of varicocele. Still on material methods, concerning semen analysis, we followed World Health Organization guidelines, including pH, volume, sperm concentration, percentage of progressive motility, percentage of live spermatozoa defined as vitality, and the leukocytes concentration. However, regarding morphology, we used the parameters set by MSOME, and for this study, we considered spermatozoa with normal morphology described by Bartov and collaborators. Now, I'm going to talk about laboratory tests performed to find abnormalities on the cytochemical parameters. First, for sperm DNA fragmentation, we used the tunnel assay. As we can see in this picture, here fragmented DNA. The underprotamination or abnormal chromatin packaging was measured using chromomycin A3 test, as we can see in this picture. Sperm mitochondrial membrane potential as an indicator of sperm functionality was determined using mitotracker green test, as seen in this picture. Stay in the mid piece. Finally, early stage of apoptosis was measured using annexin 5 test, as we can see in this picture. In the present study, statistical analysis and the confounders were performed using logistic regression, and the potential confounders parameters analyzed were age, abstinence period, body mass index, smoking habit, and the alcohol intake. Finally, I will talk about the results. In this table, we can see that potential confounder parameters like age, BMI, smoking habit, alcohol intake, and abstinence period presented no statistical significant difference between study group and the control group. In the results on semen analysis or semen parameters, we observed that sperm concentration, progressive and total motility, percentage of normal forms by MSOME, and vitality demonstrated significant difference between patients with varicocele and patients without the pathology. Important to note that the decline in the sperm conventional parameters was related to the study group. Now, concerning leukocytes concentration, there is no relevant difference between the groups. In the results of cytochemical analysis or cytochemical parameters, we can observe that DNA fragmentation, abnormal chromatin packaging, and abnormal mitochondrial membrane potential demonstrated significant difference between study and the control groups. Important to note that the worst outcomes were associated with patients presenting varicocele. However, regarding apoptosis, there is no relevant difference between the groups. Well, in addition, we decided to apply Spearman's correlation to verify if and which cytochemical parameters present the correlation with sperm DNA damage or sperm DNA fragmentation. From the cytochemical parameters, we can observe that early apoptosis and abnormal mitochondrial membrane potential were the two that presented a positive and significant correlation with sperm DNA fragmentation. Concerning abnormal chromatin packaging, we observed positive but not significant correlation. And regarding leukocytes concentration, minimal negative and not significant correlation was found. Well, in summarize, as we can see, oxidative stress, especially overproduction of ROS, is associated with sperm DNA fragmentation or sperm DNA damage. In our study, the pathway that appears to be more important in this process is the intrinsic source of ROS production, which involves abnormal mitochondrial activity. As for extrinsic source of ROS production, here represented by leukocytes, appears not to be determinant to generate sperm DNA damage in our study. So, in conclusion, this study has demonstrated linkage between presence of varicocele and decrease in semen quality. And the presence of varicocele increases DNA fragmentation, abnormal chromatin packaging, and abnormal mitochondrial activity levels, mitochondrial damage. In addition, for patients presenting varicocele, high levels of sperm mitochondrial inactivity or damage and sperm apoptosis are associated to increase the levels of sperm DNA fragmentation. However, DNA damage in our study is not related with sperm chromatin packaging and the sperm leukocytes concentration. Finally, varicocele repair and/or antioxidant intake should be considered as a feasible way to reduce sperm DNA damage. Thank you for your attention.
Okay, so we have time for at least one question, if... Okay, I'll take Chairman's thing. So, when you're doing your tunnel, obviously you're using that to segment your population into relevant damage or not. What threshold are you taking for?
Sorry, the sample semen?
Yeah, for the tunnel test, what are you setting your threshold at for significant DNA damage?
I don't understand. I don't understand your question, sorry. Can you repeat slowly? A DNA fragmentação, our cutoff is 30% with DNA fragmentation. More than 30%, we consider the DNA fragmentation increases.
Thank you once more for your
Thank you.
presentation.
Carlos Caradiza from Argentina.
Okay, one more question.
Okay. I suggest, before you make the surgery of the varicocele, to make the same study with only 1 day of abstinence, because if you have the DNA alteration with 3.5 days of abstinence, you are going to reduce your percentage of DNA fragmentation if you have the same semen analysis when 1 day only.
Okay, I agree with you. Thank you.
Hi, Virginie Baroulange from France. If I understand, your threshold for the abnormal cutoff is 30%?
Yes, for
but you have 16% of DNA fragmentation in your patient in the varicocele group, so it's a normal result. Are you agree with this?
Okay, but what we can see, or what we want to see, is the correlation with normal population without the varicocele and the patients with varicocele. If varicocele increases sperm DNA fragmentation, the cutoff for our method is 30%, but we want to see only correlation. Okay?
Thank you.
Okay. Yes. Hi.
Okay, I think we'd better let you do your question afterwards because we're running against time. So thank you very much.
Thank you.